In the past, medical records were maintained on paper, requiring healthcare workers to search through extensive files. Now, 4 pilot health centers have implemented Sova Bula, signaling a shift towards digital healthcare. What does this mean for them?
It is such a privilege to be part of the Sova Bula system and to be one of the selected health centers.
Being selected as one of the pilot health centers for Sova Bula, it felt like a great significant achievement for us.
I think given that Balelebu Health Center is one of the busiest health center between Sova and Nasiro corridor, it was important for us to pilot this app.
I feel really proud that Sova Bula Health Center has been chosen as one of the pilot sites for Sova Bula.
The benefits of digital world rather is everything is clear. One of the most challenging in paperwork is readings, meaning the way people write literature, the way people scribe. In regards to digital, it's pretty clear, the fonts are clear, and there's no issues in terms of reading minor notes or any major notes or any medications.
This platform, when we open a patient's account, case management, we can just see on the side what all conditions the patients have, if any complications are there, and what is the current CVD risk or the previous CVD risk.
From manual to digitalization, it was a little difficult because it was new to the health center and the staff that was trained. We were everywhere, but then slowly as the days turned out to weeks and we got used to the system.
Data migration is also challenging because we are transferring from paper to Sova Bula system now, which is quite challenging. It's taking a bit of time as well for Sova Bula.
So that was one of the challenging parts rather at the first place, and pretty funny because each click would literally get you to another page, and basically we would have to start all over again.
Increased waiting time. So while we were still transitioning and still adjusting to the use of tablets, there was greater waiting time for patients. But now that we've done all the pre-entries, now there is lesser waiting time for patients and there is more smooth running of the SOPD clinics.
This Sova Bula has a very good impact on our function. Now it's very easy, just 1 click and 2 click, you can find out the patient, what they're missing and what actually medicines they're taking. So this is a really good impact for the patients and for all of us.
This app also breaks down our cases into the different zones. So when we go to the analysis, we can see along the map like which of our zones has more of diabetic cases or which zone has more of complicated cases, and this can assist our public health team in carrying out targeted programs in particular zones.
The IAC materials which has been uploaded on this app is very useful because they can, while doing the group session, they can see through the pictures and photos which will make them understand better, and then they can take photos of it and they can use it in their daily lifestyle. Thank you.
Why I like it is that before with a bookwork, like for a patient you have to enter like 3 books, but for the Sova Bula it's all in one. So it's a bit, it makes work easier for our nurses.
I have a very good memorable experience with the Sova Bula. Actually, like last week I have seen one patient and she lost her prescription and I have given her about 8 medicines. So whenever she came for rewrite her prescription, it has really helped me to just go to the Sova Bula app, and then I found with the NHN number, and then I had rewritten the prescription. And really the patient was very happy, and I'm also very happy because we done it very quickly, this solution of this program because of the Sova Bula. It's a really good memorable experience for me.
While the Sova Bula was on its making period, while they were still developing it, and seeing it from planning to coming out as a fully running system and being able to use it, was one of the memorial things because of what we saw from the start to the end, and the product of it was really satisfying to be honest.
And lastly, I'd like to thank Taiwan ICDF.
Thank you, Taiwan, for developing the system Sova Bula.
A very hearty thanks to Taiwan for making us such a great move and thinking of us Fijians.
Thank you, Taiwan, from all of the hospital staffs.
Thank you so much to Taiwan ICD.
Thank you for this transition. I really like it.
Thank you,
Taiwan.
Taiwan.